Tell me more about how the CMGP Calculator program can help anyone with missed revenue who's planning on staying with the fee-for-service system. What are you offering there?
Well, with the CMGP Calculator, if you're still on the fee-for-service system, it is also available as an app as well on your phone or on your laptop or your computer right in your clinic, whichever you prefer. It is non-patient identifying. It gives the ability to enter in the amount of time you spent in the visit and all the extra little bits you did. And it gives you a total of CMGP units that you would qualify for billing to Alberta Healthcare. Now, our beta testing last fall that we did with physicians showed that they were on average leaving about 30% unbilled. That unless it was a patient, if you've seen 20 patients that day, what sticks out in your head? Is that one patient that was you were a little bit longer with, the one that there was an excessive amount of paperwork? There's maybe those 2 or 3 that really stand out. But what about those other 10 that had all that extra work that you did too, but didn't really stand out in the day? Well, as you're completing your billing, you're underbilling for that. So the CMGP calculator not only helps you to catch that, but also helps to, in a way, kind of retrain the way you're looking at your billing. So that way, when you are doing these things and you're completing the billing at the end of your day, you're looking back and remembering those tasks that you completed related to that patient visit that you can now incorporate in. And as an added bonus, our CMGP calculator and our Track My Time, they are completely free. So there's absolutely no fee for any physician to be able to use it across the province of Alberta. That's our gift to the primary care.
That's very generous of you. Thank you. How did you go about coming up with the program in the first place? Like, what kind of feedback were you hearing that this was necessary in the medical community? Like, I can't believe that people are missing up to 30% of their billable time. That's wild.
Actually, how I came up with it is one of the physicians in Fort McMurray that I worked with for over a decade. He trained me from the beginning. When you see a problem, you come to me with 3 solutions. And I kept going to him and saying, we needed extra staff. We need extra staff. And he kept saying, okay, how are we going to pay for that extra staff? And I kept finding the billing holes. And I had seen that he was underbilling with the CMGP modifier. So that's kind of where the idea kind of formulated from, was seeing these physicians and clinics over and over and over again underbill. But then when they needed resources that weren't able to be compensated for, by being able to prove to these physicians, well, if you do A, B, and C, we can get that staff member. That's kind of where the tools formatted out. It was being able to see, working with that physician in Fort McMurray, how he was missing things, and then realizing I wanted to be able to give this to every doctor in the province. So that's when 2 years ago I started sketching out the CMGP calculator on a piece of paper and then finally birthed it into the tool it is today.
And is this like a freestanding standalone program, or do you need to integrate it with your EMR?
It is a freestanding program because we didn't want to wait. We all know privacy legislation is a lot. Getting patient identifying interactions with an EMR, exactly. I'd be looking at 3 to 5 years of red tape. I didn't want to wait 3 to 5 years to be able to help you today. So we made our tool non-patient identifying, and it is a companion app off the side, either on your phone or off the side of your computer.